While these medications are extremely effective and very helpful, they can be very addictive for a lot of people, even under a doctor's care, right?
Absolutely. 1 in 8 people are on benzodiazepines right now, and about 20% of the use in general is what we would call misuse. So misuse, and the vast majority of people who are misusing them are getting them either on the street or from friends and relatives. And we know that the risk is higher in folks aged 18 to 25, and especially in men. So I would say the key here is that you must visit a behavioral health specialist, and even if you don't continue with them, just to be able to have one full, thorough evaluation, get to the heart of the matter, and make sure that the coping mechanism or the treatment isn't going to worsen what you came in with.
So patients that want to manage their anxiety, they're interested in possibly taking some of these medications. What are the specific questions that they should be asking their doctors before taking the meds?
So first question is, what's my diagnosis? Second thing is, what are the typical treatments for this, right? Because medication and benzos are one treatment, but so is therapy, so is medication, exercise, nutrition, proper sleep hygiene, getting social support. I call them the 4 M's of mental health: mindfulness, mastery, movement, and meaningful engagement. And so there are a lot of natural things that we can incorporate into our life. And then specifically to benzodiazepines, how long should I be on this, doc? What's the minimum amount I can take? And how do I get off of it? And what's the specific plan? And when would you like me to follow up with you? Because the doctor's got so many things, and they're managing like 5 or 6 different problems when you're coming in. And so saying, could I follow up with you in a month, for example? So I think especially in the beginning, it's very important that we have close follow-up with our doctor so that they can manage any side effects, and let your doctor know. Say, the dose you gave me, you know what, it's not working anymore. Do I really need more, or do I need to cut back? And then, would you recommend for me to see a therapist, and do you have any referrals for me? Because really, at the end of it, I'm a big believer in therapy, specifically cognitive behavioral therapy, which helps you get at the root of the matter, which is some habits that you could engage in and some ways of thinking that can help alleviate this distress. Because I don't see these medications, to be honest with you, as a long-term solution.
Sure. And I always say, listen, the minute you know you have to take a medication is the minute you got to start planning on how to get off the medication. So I agree with you wholeheartedly. Dr. Varma, thanks for joining us today.
Thank you so much for having me.
We're living in uncertain times. It's tough to keep up with the latest medical headlines.
About the market, panicked about COVID.
And how do those headlines impact you and your family? 100,000 people died. On season 13 of The Doctors, we want to empower you physically.
If I met them at dance, they would meet me at medicine.
Man, I love that. Emotionally.
If I can change my thoughts, I can change my feelings.
And medically.
He doesn't have his mask up, which is not a good thing.
This is the $1 million question, maybe the $1 trillion question. This is so critical for people to hear. We're giving you the inside track on health and wellness so that you can get back to the life you deserve. It's time to take back your power. The Doctors, now more than ever. Premieres September 21st.